edition of Medical Solutions Supplier Spotlight, we are putting the light on a person who has a testimony not just as a physician, but also as a patient. We're delighted to have you with us here today, Dr. Mehta. And in a capsule, tell us about your medical background first.
Okay. I'm a radiation oncologist. I've been in practice for about 30 years around Philadelphia area. At present, I'm practicing in Chalfont, Pennsylvania, which is just outside Philadelphia.
And what are the types of patients that you're treating?
I treat adult cancers, breast, prostate, lung, head and neck, pancreas. Mainly breast and prostate are the main, and I specialize in treatment of breast cancers.
And so how do you see the compression therapy helping your patients?
Okay. Well, after breast surgery as well as radiation, sometimes there is about 15% risk that patients will develop lymphedema in their arm, and so we recommend compression therapy to decompress the edema, and their quality of life will be maintained, and they'll be able to do everything they were doing before the treatment.
For those who aren't experienced with the term edema, how does that impact wound healing?
It certainly does impact wound healing tremendously, and I can tell you that, because I've seen that in so many of my patients as well as myself when I was a patient.
Well, let's talk about that, because you are not just a physician, but as I said in the intro, you're a patient. Thank you for being willing to share your personal experience. Obviously, you're doing well now, but you were diagnosed.
Yes, about 2 years ago. Now, I've always used compression therapy on my patients, breast cancer patients in their, upper extremities. And about 2 years ago, I was diagnosed with sarcoma of my right leg and had extensive surgery and radiation therapy, and did have trouble with wound healing as well as swelling of my right leg. And one day, I did talk to the rep, and who had come to see how our patients were doing, and I was telling him, and I'm very used to using compression therapy on the breast cancer patients. And while I was talking to him, and we both thought, gee, can you use that in the leg? And figured, why not? And so I got the compression therapy machine and started using it. And my incision, or the radiated area skin, which hadn't healed in about, I think about 9 to 12 months. Most of the healing had occurred, but there was one area that just wouldn't heal. Even though I had hyperbaric oxygen treatment, a lot of other, wound care, and I started using this compression therapy just so that the swelling will go down. And surprisingly, within few weeks, of course, the swelling went down the first week, but the skin that wasn't healing started healing. Looking back, it made all the sense, because once the swelling is down, the blood supply improves in that area. Your skin is not stretched, and so that helps healing.
So even as a physician, it was actually a discovery for you.
It is. It was.
This application.
Absolutely.
Now, speaking to other patients, I know one of the keys is to keep using it.
Keep using it. Yep, absolutely. And that's where I think a lot of times patients will use it in the beginning, and then as time goes on, they start using less. And I keep stressing to them that use it all the time. And of course, in my case also, I did the same thing. I started using it, religiously, and then once you start to feel better, it's a natural tendency, it's a human tendency that, you start to back off. So once in a while I back off, but then I get back on track.
One of the things I'm learning is that edema is prevalent in wound care.
And I think what happens is anytime you've had surgery or radiation, the lymph channels as well as sometimes lymph nodes are removed. And even though the body does develop collateral lymphatic channels, sometimes it's never enough, and especially in a lower extremity where you're going against gravity. So the wound care, wound healing is always a problem, as well as the swelling. And also the swelling, if unless you, and even though I've been practicing for 30 years, I didn't really realize how cumbersome that swelling is. It's almost like you're carrying that extra 10-pound weight in your arm or in your leg. And just decompressing that swelling can make so much difference.
And so you've experienced it with your patients as well. I'm sure, having experienced it personally, you give a great recommendation to the use of the pump therapy.
Absolutely. Absolutely.
So let's talk about the fact that you've probably been inundated with sales pitches from different companies, your long career. What makes Medical Solutions Supplier stand out?
First of all, they whenever they come to the office, they're mainly, how are the patients doing? What can we do? They're not not overly aggressive in marketing. They're not even aggressive in marketing. We would just sit down and they would just say, so how are the patients doing? What can we do to make it better? And that's why I said, I hadn't even thought about it. And we just sitting and talking, and they're like, and I was the one who brought up and saying, I wonder if it'll help in my leg. And they're like, I see, you can certainly try it. I can't see any reason why it won't help. And I really, that's one thing I like about them, is that they're just there to help. And
yeah, and they help their patients get the pumps too, because sometimes that's a real challenge, financially and just working out the paperwork and going to bat for patients.
And also, I do know of a couple of occasions where the insurance company was giving them a hard time, and they donated the pump to the patient.
That says a lot about the integrity of the company. Good. So if we had a room full of physicians watching this interview, what would you tell them?
First of all, starting with, anytime a patient does have swelling or any, even though we've read textbooks and seen hundreds of patients, we would never realize, and sometimes patients themselves don't realize how their quality of life is impacted. They sort of expect, oh, okay, well, what do you expect? I've had surgery, I've had radiation, I have to live with this. Not true. Not true at all. Because there are so many things that can be done so that you don't have to live with a lot of these side effects from surgery, radiation, chemo.
So if we had a group of patients sitting in the audience, I think what you would say would give them hope.
Yes, absolutely. And also that, you can go. I mean, I myself was okay with that leg swelling and changing dressing every day. And I used to tell myself, well, if all I have to do is change the dressing every day, I'll be I'm a lucky gal. But then once you start, realize that even though you're very happy that you're cancer-free, there are things that can be done to make even to improve your quality of life.
Well, your story is inspirational. And is there anything else you'd want to share with our viewers?
Just that it's very common to be diagnosed with cancer. One of the motto is that we want to make cancer a chronic disease, just like high blood pressure or diabetes, where you can live the rest of your natural life with as little impact on quality of life as possible.
Well, that's great news, and that's a great approach, and we thank you so much for your time here today. Appreciate it, and thank you for tuning into this edition of Medical Solutions Supplier Spotlight. We hope you were inspired by Dr. Mehta's story.